week on, and I just want to find out what's going on. I know that night, the president announced that there was a lockdown.
It is my job to protect you, and I'm determined to do just that. Effective 1 a.m. on Monday, 30th March, means that everyone resident in these areas must stay at home for the next 2 weeks.
So I'm back here with Bella. We spoke last week about the COVID-19 situation in Ghana, and we're a week on, and I just want to find out what's going on. I know that night, the president announced that there was a lockdown. So what's happened since then?
So the night we spoke, the president, we waited for the longest time. He finally got on live television around, I think it was like 11 p.m. And then he announced that they thought it over. It was a very hard decision. He knows it's going to impact a lot of people. But the only way to move forward is to basically lock down our households too. So basically he said that the one thing that we can't do, or we don't know how to do, is bring people back to life. But the one thing we do know how to do is to rebuild economies and businesses.
It's day number 4 of quarantine. First time I've decided to leave the house since it started, because I had to go out and get medicine and all of that. Standing out to me is there's obviously no cars anywhere, but there is no public privatized transport, the trotros that we usually see and stuff. None of them. Just a few cars here and there, but most of the streets are cleared. Like an area like East Saigon is usually full as hell. You can see even the street food stands and stuff. Everything is cleared out here, And how much is the eggplant? The garden eggs?
1 for 2 CD.
Hey.
1 for 1 CD.
1 for 1 CD. Yes. Okay, if I can get 6. So I'm going in right now to a shopping place to go and get a few things for the week, and there's cars here, guys. I mean, it's pretty empty compared to how it usually is, but it's empty. It's full nonetheless. There's still people on the side of the roads. The only people that are opened are people selling foods, so that's there. But all the non-essential things, they're gone from the street. Even my coconut seller isn't around, which is a bit disappointing. But anyway, people are following the rules, generally speaking, in this area. They just put these plastic gloves on you when you go in there. I inserted some pictures as well of how the people are protecting themselves and stuff. Sucks for the plastic, but at least they're taking precautions. Show you guys. I'm on the way back home now from having gone to the supermarket to grab 1 or 2 things. This is how bare the streets are. Okay, and then you'll see little chaos shops with food still open. Grocery place here still open. But for the most part, the roadside street food and all of that, everybody's gone. Everybody's gone. People are still taking walks though, which they're allowed to do, getting their exercise in. The streets are empty, guys. So I'm guessing that maybe the police blocks, the military blocks are at the exit of every community. So maybe that's what's happening. At the pharmacy that I'll insert a picture of that. They have precautions, they have a window now, which they didn't have 2 weeks ago. I'm home now. I managed not to touch my face the whole time. I'm just about to take off my mask, which, because I'm zero waste or low waste, I have reusable masks that I wash. of rubbing alcohol and vinegar. I'm just gonna spray down like outside part, and then the rest will wash inside the house. All our shoes are outside because that was the recommended thing to do. This has also not stopped for people. My neighbors, for example, they're having church service with one another in their houses with their kids.
So everybody sort of like was on board with what he was saying. Obviously, it's affected like the person that, like I said before in the last interview, that has to live from day to day salary, you know.
Mm-hmm.
But the lockdown hasn't been like everybody is not allowed to be out there. Like people that provide essential services still have the ability to provide those services.
Okay.
So for example, not only like the people that work in the medical field get to go out, but for example, they've given these cards which allow you to go out to work. If, for example, you're a seller that sells fruits and vegetables by the side of the road, which you'll see in that happening. But non-essentials, like for example, the people that sell in Ghana, we still have credit prepaid systems for our phones. So you can basically, now we have mobile money, so most people do it online, that they recharge, but you still have vendors on the side of the road that sell those, or when you're going through traffic, there's still people selling non-essential items, and those people are affected. Even the fruits and vegetables people by the side of the road, they're still affected because most people do not want to leave their house unless it's absolutely necessary. So the spontaneous buyer has disappeared, which in Ghana, that's a lot. You know, those are the people driving through the streets and maybe picking up something as they're driving. So they've lost that business aspect. And then there's a lot of people like the company I and my sister own. Obviously, we're non-essential goods. We're handmade items. So our workers are now stuck at home. But so those kind of people, they've lost out on business, right? But for example, with us, what we're doing is we're actually financing them through the quarantine and just putting in orders just so that they have something to do and they have some sort of income during the time that they're there. But things like mobile money has changed the game for us here, you know, because everything is now online.
Mm-hmm.
So it hasn't affected us as bad as it would maybe have affected us if we were like 5 or 10 years backwards, you know.
Yeah, so mobile money, for everyone that doesn't know what it is, I mean, I only know limited amount about it, but what I know is any time that I've had to pay somebody in Ghana, I've had to mobile money them. And I actually use this website called World. I don't know if you've heard of that one. So I can remit to mobile money, but it's, yeah, if you could just explain what mobile money is, that would be great.
Okay, so the first time I heard of mobile money was even before I moved to Ghana. There was a report on it on BBC. BBC has this like channel called Pigeon, BBC Pigeon.
Oh yeah.
So it's basically like local news for the African continent in like, you know, our local Pigeon English. And then when I moved here, I was very interested to do it because most of my friends had it, and it seemed like very easy, you know, because you don't need a bank account, you don't need to like go to a bank and register and all of this. But what you have to do is you go to a telecommunication company, so a network provider, and you give them an ID card and they register you in the system, and then you basically have like a bank account with them.
Okay.
And it's like a debit system. So for example, I'd go to a vendor. This is where the vendors become essential again. I go to a vendor, I give him, let's say, 100 Ghana cedis, and then he loads my bank account virtually with the 100 Ghana cedis. And like that, I can just, through everybody else's telephone numbers, I can pay them money.
So can you hold money on your mobile money? Like could you put on like 1,000 Ghana cedis and just save there, for example?
Yeah, the limit is like 10,000 Ghana cedis for like that, for anybody. And it also changed the game because like lately, for example, when the lockdown happened, I forgot to buy electricity, which is, for example, in Ghana, we have prepaid systems as well. So you pay as you go. Some people have like, they pay the monthly fee of whatever they use, but like for most homes, it's pay as you go. So there's like an app for the electricity, and you can basically pay via mobile money through that app.
Okay.
So I had forgotten to actually load my my mobile money account, which I had to do that with a vendor. So I had to basically do a bank transfer from my banking account, my real banking account, into my mobile money, and then pay like that through my electricity. But lately, like I found out that the mobile money since this year, they also allow loans.
Oh.
So there's like a credit system as well. So if you don't have the money on the account, you can still ask for a loan from MTN based on how much you have spent, like in your mobile money account. You have a limit. And then basically you have 30 days to repay it. Others, there's an interest rate. I think the interest rate is like 3%. It's very high. So I checked that out this week. So obviously there's ways around it during the lockdown for people to still sort of survive. But you can imagine 3% interest is a lot for a lot of people.
is really low here though.
Like for me, it's high because in Switzerland, interest rate is 1.5%.
Oh, is
But
it?
I mean,
Oh my
Switzerland
gosh,
is
that's amazing.
Yeah. But Switzerland is also like a financial haven in that sense, So because most people are paid very well, so it's like they can bank on everybody,
Okay,
But
yeah.
in Ghana, for me, in like comparison, in Ghana, 3% is it's a lot for an average.
I guess, okay, so everything's practically moved over to mobile money, because I heard they're trying not to use cash at the moment.
Oh yeah. So obviously for somebody like me, I'm an overthinker and I know how systems work. So I'm a bit worried about what that means in terms of tracking people and their movement. But it makes sense here. Most people cannot afford to open a bank account. So that it gives people opportunity to move on virtual platforms, especially like during the time of quarantine, like now, and have access to money flow that maybe they might not necessarily have had if everything was in a cash system,
Yeah. Is you had a nanny, or you have a nanny? Is your nanny still staying with you?
Yeah, so I have a helper. She's called Dorothy. She's staying with us. She stayed with us from the beginning of the lockdown. Dorothy actually, like on regular, stays with us from Monday till Saturday night, and then usually she goes off for like a day and a half and then comes back again. But obviously with the lockdown, she also feels safer being here, So we talked about it, and she said to me, look, I feel safer being with you guys. There's a full fridge, there's kids to keep me occupied. I have my own space, so I'd rather be here. So she's with us. I'm very lucky because I know a lot of people that have kids here, like friends of mine. They had to send their nannies off because their nannies wanted to go back like to the villages or wanted to go back to their families, So, I mean, it's a great thing because people get to reconnect with their kids, which I think they don't understand that they get that advantage. But in my case, I'm reconnecting with my kids, and I also have somebody that can help me out, and my mom is also staying with us since the lockdown as well. My house is full. House is very full.
And I wonder what it's like. I don't know if you've spoken to anyone who lives in a village or outside of Accra and Kumasi, or like someone that lives outside of a main city. What it's like at this time, do you know?
Yeah, so I've been like vicariously living through Dorothy's experience. She has family that is not in Accra. It's in the eastern region, so they're a bit further away, about 6-7 hours away from here. And her family is holding up well. They're all in communication. They're on conference calls the whole time, talking to one another. Her mother is a rice farmer. So actually for her, it's increased business because people want to like locally source their food now, because there's a limited amount of like importation happening right now. Even though the government said they would continue, people are scurrying around for like the imported stuff. So it's giving an opportunity to the local farmer as well. So for her, it's actually been a vantage point, and she has her farm directly on her land in her house. So she goes out there, she farms, she basically sends the stuff to Accra and then she sells off like that. I think the people in the villages might not feel like they're going to be affected by this. They feel like it's a big city problem. It's less like Accra is Takoradi, you know. And my boyfriend lives in Takoradi, for example, and they're not on lockdown. Life is happening.
Oh, are they not?
No. It's just Kumasi and Accra and a few parts of certain regions. But Takoradi, for example, big oil city, no lockdown, because they didn't have even one reported case there. You know, so they're going based on like the reported cases, and the virus like started in Accra and then it spread to Kumasi. So for them, it's like the problem was in Accra and needs to be contained in Accra.
Yeah.
So nobody's allowed to leave Accra to go out, and nobody's allowed to leave Takoradi to come to Accra. But in Takoradi, they can roam around freely. I mean, his business is open, he's making his money. And actually, funny enough, because there is like all the stores in Accra are closed, he's getting more business there. You know.
Okay.
So I think actually economically it's probably benefiting more of like the people that live outside of the metropolis of Accra and Kumasi, because those people are not getting an opportunity to sell.
Yeah. No, that's
you know, and produce.
that's good.
Yeah.
So if we turn to like the situation of hospitals, I think what a lot of people are interested in as well is like the health system, or what I'm actually interested in, you know, if I'm thinking about potentially living in Ghana in the future. Do you have like health insurance that you pay every month, or how does it work for you?
So I personally, I don't have that. I'm lucky enough to have like a day job where they pay a certain amount every year. So I can go to like the doctor's visits, even they cover my kids every year.
All right,
So
so
that's
they
sort of
basically pay for your health insurance.
Yeah, so basically that's something you can negotiate with whoever you're working for. But I don't have health insurance that I have to pay monthly and assures me like certain visits. But also going to the hospital here is way, way cheaper than it is in Europe.
Okay.
You know, so like it depends on where you go. By like there's 24-hour clinics, for example, and these are all like private clinics. You know, so like there's one called HealthNet that I frequently go to in Airport Residential. It's 24 hours. So if I have an emergency, we can go, doors are open whenever, and it's privatized. So there is a limited amount of clients that or patients they take in a given time. But as well, I've heard like there's a lab here in East Legon that runs like all sorts of tests. And I saw that they have like a client's card, and they have like a health insurance system. So you don't pay as much as like the walk-in client would, you know, but it's an internal insurance system, and you have to pay a monthly fee to be a part of it. So it's very privatized here in that sense. You know, we don't have big corporations that you can sign up with.
But
But
in terms of like Corona,
yeah, so no, there's only one place that can like test for it here.
Right.
Do the test. But the government has moved, like I told you before, and I think they're expanding more and more. They've moved into closing hotels and basically turning those hotels into like quarantine quarters.
Yeah.
Right. And they're also moving like away from the concept of quarantining people outside of their homes. So since the lockdown happened, there's hotlines that you can call, and then they'll come and test you at home, and they'll quarantine you in your home. Because the assumption is if you live alone, you're by yourself. You're not going to go out and potentially affect somebody else in the system. And if you live like I do with children and with others, then it's like chances are they probably have it. So everybody has to anyway quarantine and take care of themselves as a whole, you know. So I think that's how they're relieving the pressure of like the medical system. I think the week before they ordered a whole bunch of tests, and actually there was like reports coming out that where I live and some other areas like in Jolun Airport, there were hotspots for corona. So
Oh.
these were supposed to be places where it's more likely that corona was gonna be multiplying in our places. So there was like I don't know whether it was fake news, but there was like a statement that came out saying that they were gonna do obligatory tests in all of these places, so house to house. Then they came out, I think, a day later, and they said whatever was published was not published in full capacity, but what they were actually doing is retrace, like providing them with tests. But then literally 2 days ago, a friend of mine got on the chat, like a friend chat that we have, and she said she lives in East Legon, like not far from where I live, and she's like, they just came to my house and tested me. And she asked them, did anyone mention my name? Was it via like retracing? And they said, no, it's random.
What? That's good,
Yeah.
I guess.
I mean, look, there's like, all of us are really excited if they do that. But then at the same time, we're like, there's always that doubt that maybe they're not taking the right precautions when they're doing the test. And then they could be carrying it themselves and transferring it from one person to the other, you know?
Yeah.
So, and imagine like if they come and test you and you test negative, but then you still have 14 days from the day they tested you to catch it. So you could catch it after the fact. So, I mean, I had friends that were like, I'm going to lock myself in the house. If they come, I'm not answering the door. I'm not doing it, you know, because I'm not showing symptoms. There's no reason to do it to me. And then there were people where they were like, oh, no, I'm happy because this is free of charge. And at least I'll know my status.
Yeah.
I mean, they didn't come to us till now, but they did come to my friend like a couple of streets down the road. So I guess it is random in that fact.
And are you allowed to, what is the rules? Are you allowed to go out and exercise or not? You're just allowed to go to the shop?
Oh, yeah.
Oh, you are?
Yeah. So in the video I made on day number 4 of quarantine, you'll see like people walking on the streets, people going for jogs. I went for grocery shopping, not far from where I live, and like on the way back, I saw the same people jogging, like basically like a 10-minute drive down the road already. So people are out, they're about, they're on their phones, but there's a lot of social distancing. Like they won't get closer to one another, you know.
Okay. Yeah.
And even like in the shopping places, I was fascinated. So like I went to a woman on the side of the road that sells vegetables and fruits, which I regularly go to her. The two things I noticed is she had a mask on, but she was like halfway wearing it the whole time. But she kept her distance from me. Like she didn't get close to me, you know. And so I did the shopping there with my bags. Everything was cool, but the price was like double.
Oh, really?
Yeah, the prices were double, which in East Legon anyway, buying like on any of the road residential areas, like on the side of the road, is expensive. Okay, so usually I pay 50 pesos for eggplant, like one eggplant, right? Garden eggs, we call them. And now it's paying 1 Ghana cedis. So the price doubled. The same thing happened with like the tomatoes. I was paying 15 Ghana cedis before for like a whole bunch of tomatoes, and now I think I was paying like 25 Ghana cedis.
But do you think that's because the sellers are worried that they're going to be off the streets soon?
Oh yeah.
Okay.
Yeah, for sure. No, I also I don't think they think they'll be off the streets, but I think they think to themselves, I have a lower amount of customers coming to purchase than I had before. So it makes more sense. I mean, inflation makes sense in that order. Like I'm lucky enough to not worry too much about having to pay more, and I feel like it's my responsibility to do so and not to argue, because I understand what's happening to those kind of people. But at the same time, it's like, obviously, if you have a budget, now you're going to have to rebudget, So yeah, so that's happening. But in the shopping center that I went to, which is a Max Smart, I was in shock because I went there like maybe 2 weeks ago, and now like all the workers there had like these military type like plastic shields around their eyes,
That's good.
like, yeah, and then they had the masks, and they had gloves on it as well, and they had their disinfectant at every till, so they were disinfecting after every client.
That's really
and
good.
like, yeah, and like walking in, obviously being plastic free, I wasn't too happy about it, but I was like, I understand it. They gave you gloves to wear, and you're not allowed to enter unless you wear the gloves. And she's like, you can do whatever you want with the gloves after, but you cannot come in here unless you're wearing gloves. And then she said, where's your mask? And I said, I have my mask on. And then she's like, why don't you, because I have fabric masks. So she was like asking me why don't I have like the regular masks? I explained to her, and then she's like, fine, as long as you have a mask on, you can go in. So they're watching, and then you'll see like on the floors at the till area, they have like marcated areas where you have to stand, and it's called social distancing. It's written on the floor, social distancing. So
really
everybody stands in those areas. Yeah. So
they have the same thing. They don't have the masks or the goggles. I wear a mask when I go into the shop, and I wear gloves, but majority of the people aren't wearing gloves or masks, and the staff aren't wearing gloves or masks, which I find strange, because do they not feel at risk? The only thing that they have is those lines on the floor, so you have to queue to get into the shop. You have to queue when you're putting your things on the cashier till thing. But apart from that, and social distancing. So it sounds like they're doing a really good job over there.
No, I mean, they really are. And, like I saw this video on Facebook of a nurse in the US, and she basically quit her job because they were refusing to provide them with masks and gloves, because they just didn't have it anymore. So then I think to myself, then you have a grocery cashier or a butcher, and they're being provided those things to feel safe in their environment. So then I'm like, actually, we're doing a good job here, so yeah, in that respect, everything's good. The medical field, definitely, they're also taking precautions, like the ones I've been exposed to, because my mom recently had issues with her blood pressure. So she has to go weekly to a lab to go and get tested. So we know how much medication she has to be taking. So I've been like in contact with the labs. I've been in contact with the doctor, the privatized doctor's office that I have to go to get like the recommendation to go to the lab. And then I've been in contact with the pharmacies, having to get like the drugs. And you'll see like the pharmacy I went to, which is actually a funny story. It's right behind our house, and it's it's owned by the woman who is a mother to one of Nyla's school friends.
Oh.
So like she's even offered to like drop off whatever I need in the house, so I don't have to leave the house anymore. So they have a service like that too. She says that they have no card, and he drives around and gives medicine. They just call up and do the mobile money. But so when I went, she's created a little window.
Is it like a plastic barrier situation, or is it?
No, it's an actual window in the glass.
Oh wow!
In her glass display, an actual window, and she's written like she has like all kinds of signage about Corona, and that they're trying to provide safety to everybody, including their staff. So this is a form of social distancing. So you go to the window, you can actually wash your hands, like there's a bucket, there's a disinfectant, and then you can order what you need, and then they'll bring it to the window.
Oh, that's really good.
So yeah, so I mean, people are taking precautions. People are really taking this serious, which is pretty. And this morning, I actually heard like two of my neighbors. They met up and with their kids, and they were doing church service at home. So they were playing like their music. I could hear them singing. I could hear them reading Bible verses. So I mean, we're still trying to be social in that sense.
Hmm. Obviously, it's so sad like that. I've not checked the numbers today, but it has increased the
Oh
amount of
yeah,
people that have died in Ghana. Has it?
yeah. So I'm not too sure about how many people have died, but I know we're over 200 people now that have contracted it.
Okay.
And then I know there is 31 recovered, 31
Oh,
people that have
that's
recovered
good.
from it. Yeah, and the last time I checked, it was 5 people that had died, but I don't know whether that has risen.
Yeah, I'll have a look. But that
Yeah.
seems to be a high percentage of recoveries.
Yeah, I mean the virus is quite novel, and I think that's why it feels very scary to a lot of us because we don't know how to deal with it. We don't know what it's going to evolve into, what kind of strain you might catch. You know, you yourself might not know of any health issues you have until you catch it.
Yeah.
So there's always that fear, but it acts like every other virus in the sense that if you are in a disposition health-wise, chances are you're not going to be recovering from it, you know. But I have a friend that is basically in remission now. He's recovered, you know, and he told me it was very bad in the beginning, and then it sort of became like a flu, and then it left. He had to basically deal with every symptom as he was going. So if he developed a cough, he had to address it with cough syrup. If he developed like inability to breathe, then he had to tackle that with medication as well, you know.
Yeah.
So yeah, people are treating it on a symptom-based solution until they test twice negative, and then you can say they're recovered. So
And
that's sort of
has the government given any indication on how long you're going to be in quarantine for, or not?
So I was hearing rumors this morning that they're going to extend it by 2 more weeks.
Okay. And then I
So
guess
it'll
you
be
keep assessing it probably every
yeah.
2
But
weeks.
the borders for sure they're closed until end of April, so the 2 weeks, and then they're even talking now about the fact that it should be even closed longer, you know, until the rest of the world has sort of like dealt with the situation. It's probably not a good idea to like start up tourism again, you know,
Yeah.
which it makes total sense. And they're not like limiting Guineans that are abroad to come back. They just, when they come, they have to be in quarantine and they have to be tested. But tourism in that sense is shut down. And I know that they're doing evacuation flights out of the country as well.
I heard that different embassies
Yeah.
are basically taking their people out back to their home countries.
Yeah, so actually somebody that I know, a Lebanese person, he got like a notification from the embassy saying that they could leave, but they have to pay for their flights to leave back.
Oh.
It's not for free, obviously, and it's quite expensive. It's per person, $1,800.
Yeah.
So I mean, in a lot of Lebanese families, there's not just one person. Like it's and a mother and a father, you know.
Yeah.
So
I'm like, my internet.
that's
I'm leaving
definitely
more and more out the door because my internet, the internet is downstairs and I'm upstairs. Do you know what I mean? So it's just like.
yeah, I have that too. That's why this is probably the only position it works in. But yeah. No, so yeah, and I mean the streets are not as full as they were, but that's
It's
normal.
actually, I just can't. It's just like, it's just unbelievable, isn't it? And then it's like, what do you do? Because right now, I'm basically spending my time like looking after the kids, but I'm also spending a lot of time focusing on what I'm going to do afterwards. So I was meant to come to Ghana in July, but I'm guessing that's not going to happen. And
Mm-hmm.
so I'm just like, and that's difficult for me as well, because like I don't like being in one place for too long. But obviously I understand that, you know, this is like a pandemic and it doesn't really matter, you know, if I go there and
Yeah, no, I get that.
here.
No,
But
I get
how
that.
do you
I
feel
get
like?
that.
How do you feel
I
like?
mean, it's look, the thing is that, like, I'm sure this is how you'd feel if you were living here. I feel at home in Ghana, you know, and I feel
Yeah.
the safest here. So I don't really feel like I'm at a disposition, but the kid's dad doesn't live here, you know. So, and we were meant to go to Switzerland literally a week before the shutdown, and then our flights got cancelled, and it was just not advisable to go. So it's hard like that because he doesn't get to see his kids, you know,
Yeah.
and we don't know how long this thing will go on for. And it's not just a matter of when borders will reopen in Ghana, it's a matter of also when borders in Switzerland will reopen
Yeah.
or when the numbers will go down, because Switzerland is on the 10th place for the most affected.
Wow.
We only have 8 million people. And at the last time I checked, the numbers were, I think, 20,000 people affected.
Oh my gosh.
Yeah. So, I mean, for such a small place, it's a lot, you know. So we had to have that discussion, and it was a very hard discussion, but for me it was the most important thing is just I'm not putting my kids at risk. I know it, like, there's reports that it's not affecting children, but then there's reports of kids also dying, you know. And if I put myself in that position, I might catch it and then take it back to my mother who's elderly,
Mm-hmm.
you know. So it was a hard decision, but it was a decision that we had to reach. So in terms of that, I think that's the hardest thing, knowing that the kids will not get to see him for quite some time again, and it's hard for him as well, you know. So that's the hard part. So I can't imagine what it's like for like families that live apart. But I mean, I'm extremely grateful because to be able to be in lockdown and to still have like a full fridge, a roof around my head, my kids have the privilege of being with their friends. Like, there's not much to complain about in that sense, you know what I mean?
Yeah, no, same. I mean, I'm also really grateful, like, to be able to go to the shop and spend like as much as I
Yeah,
need to spend to get the food to not go back to the shop for as long as possible
yeah,
is like
yeah.
a blessing.
It's amazing, yeah. But I mean, obviously, as a mom, you know how it is. Like, the only alone time we're getting now is when we lock ourselves in the bathroom and take a shower.
I know.
So,
But I
so I mean, yeah. Mental health wise is another story.
I
It's
know,
a
I'm
it's a
just like,
completely different story.
even to come up here and do this, I had to like warn my husband like in advance, like I need to go and do some work. Like on Sunday I'm working all day because I've got stuff to do,
Mhm,
but he's still working like during the week, so it's like I'm
mhm.
with the kids during the week.
No, like, I haven't. I told my boss this the other day. I was like, dude, I have to be completely honest with you. If you wanna end up taking this away as my holiday period, do it,
Oh,
because
yeah.
I'll be very honest with you. It's like virtually impossible to get anything done with the kids around.
Yeah.
Like, and I know like a lot of my friends are joking, like, oh, you're always on TikTok and stuff, but those kind of stuff is like 2 minutes. And it's like my sanity, you know what I mean? It's like 2 minutes, the kids are napping, I'm gonna lock myself up and just do something for myself. And it's fun, you know, it's
Yeah, it is
one of the
fun.
only things to boost my energy, you know, boost my morale again. So, but like to sit down and to be like, okay, I'm gonna work, and then every 2 seconds another kid is in here, and it's like a game for them, you know. It's not even like I need something. It's just like, hey, wonder what mom is doing. So, as hard as it is sometimes, it's okay. Maybe it's time that we all refocus on what's going on in our homes.
Yeah, the things that are
And this
most
gives us,
important.
yeah,
Yeah,
and this gives us the opportunity. So yeah, focusing on what to be grateful for.
definitely. Great. Thanks so much for chatting to me, Bella, again. And happy birthday. It's Bella's 29th birthday today. So everyone
Thank
head
you.
over to her Instagram and send her some birthday love.
Thank you.
Yeah, I'll talk to you later.